Good morning, good afternoon. Thank you for joining us. We'll just give it a couple seconds as people join, and then we'll get started. Well, why don't we get started? And I'm sure additional folks will be joining. My name's Dee Logan. I'm a project manager here at the Transitions to Adulthood Center for Research, and it's my pleasure to introduce you to part two of our two-part webinar series, Youth and Young Adults with Serious Mental Health Conditions, Reflections on 30 Years. And this time we're talking about the research. And today we'll have with us Amanda Basco, Marianne Davis, and Nancy Korloff. Next slide, please. And our discussant will be Dr. Catherine Sabella. So just a few webinar housekeeping. The webinar is being recorded and will be made available on the Transitions to Adulthood Center for Research's website, so be on the lookout. We do have ASL interpreters who are available, and live captions are being auto-generated by Zoom. If you need to enable them, the icon is in the control panel at the bottom of your Zoom window. Please note that because this is a webinar, participants are automatically muted with your cameras off. Also, there will be a moderated Q&A session at 2 points in the webinar. One before 1 p.m. so that folks who may have to leave before 1 can get their questions answered, and again at the end of the presentation. Please use the Q&A button and/or the chat to send us questions. And if you have to leave by 1 p.m., please put a star or an asterisk or something at the beginning of your question. If you have any problems, you can send a DM to D. Logan, the host, or an email. I want to acknowledge that the Transitions to Adulthood Center for Research is a research center within the Implementation Science and Practice Advances Research Center at UMass Chan Medical School. The contents of this presentation are supported in part under several different grants from NIDLR and SAMHSA. So thank you both for funding this webinar. Next slide. And now I'm going to turn it over to Dr. Marianne Davis. Thank you everyone for joining us.
Thank you, Dee, and good afternoon, everybody. I'm Marianne Davis. I'm the former director of the Transitions to Adulthood Center for Research, and I say former because I recently retired, and that was one of the impetuses for actually doing this two-part webinar series. Part one was aired on May 12th, and as Dee said, it is available on our website if you'd like to see it, and Gwen White and Bree Maselli were the presenters for that webinar. And then part two is today. And essentially, after I retired, Nancy Korloff, who is presenting here today with us, we were talking. Nancy had retired before me, and we were realizing that a lot of the people who sort of got the field going had retired. And that we were at risk of losing sort of the story of the initiation and kind of launch of this field and a bit of the story of it. So we wanted to do something to capture that. This picture that you're looking at is from about 10 years ago. In the upper right and standing and going clockwise then is Diane Sontheimer, me, Gwen White, and Nancy Korloff. In 1995, Nancy had already been doing research on youth and transition to adulthood for several years. I was just getting started. Diane, who was the deputy chief of child, adolescent, and family, the branch of the Center for Mental Health Services within the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, started really pushing, I would say, advocating, using her voice in 1998 and going forward to really bring to SAMHSA's attention this population and try to bring some funding to the issue to improve services for young people as they transitioned into adulthood. And then Gwen White in 2002 was one of the first recipients of those initial grants. And essentially, each of us has gone on in the 30 years since to make substantial contributions to the field. Um, and then Bree Maselli and Amanda Basco in 1995 were really too young at that point to be making contributions. Amanda recently said that she was still playing with Polly Pockets at that point, but they were both really on the forefront of infusing youth voice into both services and research and have made substantial contributions, and we're lucky to have them with us on these webinars. So with the webinar series, we really hope to acknowledge and describe the initiation and progress in this field, and to identify important themes that we've observed and that we believe are enduring. And what we're sharing is not a formal review of the research in the field. That would be really tedious and really long, but rather sort of from our perspectives, some of the important things that occurred over time. And finally, we want to say that this webinar series was conceived of long before the current federal administration took office and has made such substantial changes in the federal government. But we think it is even more important now that we capture some of the important developments in the field, that we note enduring themes, that we encourage the passion and the hope that we've all had for this field for folks going forward. Sorry for doing that with the same page. So, where were we in 1995? Hopefully, this picture either brings up memories or looks historical to some people. So, Bill Clinton was president. Most people were using really large desktop computers with bulky towers that instead of a thumb drive or the internet, which barely existed at that point, we used 3.5-inch floppy drives to move things around, to copy things over. Um, the most popular cell phone was a Nokia, and it was far from smart. And the flip phones weren't even introduced until 1996. So 95 was quite a while ago. This is Hootie and the Blowfish, who were the biggest band for that year. And many of you may have seen Toy Story. It actually came out and it was one of the best movies of 1995. So 95, 30 years ago is a while ago. But what was going on in mental health services at that point? So when we really wanted to start this retrospective, um, Diane Sondheimer was not yet, may not have actually been working at SAMHSA quite at the point that we had gotten a small contract from SAMHSA to evaluate state efforts to implement systems of care for children's mental health. And Susan Yelton and I did surveys of states and found that as of 1994, there were still 13 states that didn't even have a administratively separate child mental health system from their adult mental health system. There was one system, it was clearly dominated by the adult system. But for most states, they were split into child and adult systems. And the children's systems, their target populations were referred to as those with serious emotional disturbance, or SED. And the adult systems were referred to as those with serious mental illness, or SMI. And there was a belief at the time that SED conditions were temporary, that children would grow out of them, that they were largely circumstantial, and that they were very different from the mental health conditions that defined serious mental illness, which people believed really could only develop in adulthood. And so the two sides of the mental health system weren't even viewing that they had a shared population with some sort of a serious mental health condition. And one of the early things that we were able to do was to really look at and show that it's the same population. It's those with the most serious mental health conditions that impede their functioning for whatever that functioning is appropriately at that stage of their life. But at that point, there was only these two very separate populations in two very separate systems. And there were very scattered services throughout the US that addressed anything that helped a young person transition into their role as an adult, to finish schooling, move on into their work and their work lives, maybe further education, to live independently. And Rusty Clark's paper that came out in 1993 was really the first to try to capture something about what those services looked like. He had gotten nominated best practices that he then summarized in a paper and talked about what were their shared features of those that were considered quite good. And that actually became the foundation for the transition to independence process model that Rusty then developed over many years after that, and first published about it in 2000 in a volume in a book that Rusty and I actually edited that had some of the most current thinking at the time. But in 1995, there was just this description of what were maybe some model practices. The other thing in 95 was there was no term for this age group. You had adolescents, some people still referred to them as children. There were adults, maybe young adults, but there was nothing to really align with this group that was at the ages where you transition from being an adolescent into being an adult. The first term that really came out, particularly within the mental health population, was by Judith Cook in 1997, and she used the term transition-aged youths. And that is a term that we subsequently used for even up till today. We still refer to transition-aged youths. The term emerging adulthood, which many of you may also recognize, wasn't coined until 2000 by Jeff Arnett, and that referred to the general population of 18 through their 20s as a developmentally distinct stage. So that's kind of where services were. There were a variety of policies that had really been launched in the 70s and 80s that sort of reflected and sparked interest in youth transitioning. There were a couple of them that focused on accessing vocational education or getting vocational services. But the one that was really the most impactful was the Education of the Handicapped Act, which was passed in 1975. But in 1983, its amendments authorized new transitional services into work, post-secondary education, and adult services. It encouraged the Secretary of Education to develop model secondary and transitional programs to assist what they called at the time handicapped students in the transition to post-secondary life through grant programs. And it also highlighted that we needed more research. But it didn't require transition planning or transition programs. And Nancy published a paper in 1990 that collected data in 88 that showed that there were only 4 states that actually required transition planning for all their students. And so it was not very broadly embraced at that point. But in 1990, the newly renamed Individuals with Disabilities Education Act, more commonly known as IDEA, mandated transition planning, and that really focused a lot of research on the transition process and students with disabilities and what was happening for that population. One of the other hallmarks about mental health services also is advocacy. And in 1995, there were really three forms of advocacy that were very prominent. The most prominent was probably the National Alliance on Mental Illness, also known as NAMI. It was started by families of adults with schizophrenia back in the 70s, and in 1995 was still really advocacy done primarily by the family members of adults with serious mental illness. Also throughout the 90s, what was called the consumer movement, which were adult consumers of mental health services, had become very active. Some of the consumer-led organizations really got their launch then. SAMHSA had done some model demonstrations of consumer-led organizations. So there was a lot of that initiative going on. There wasn't a single sort of national organization in the way that there is a NAMI, but it was a very active set of organizations. And then there was also the Federation of Families for Children's Mental Health, which became national in 1989. And this was family members, but it was the only one that was focused on children and adolescents who had serious mental health conditions. And at the time, they would have referred to it as a serious emotional disturbance. And so there was no national advocacy organization for youth or young adults with serious mental health conditions until 2001, when SAMHSA initiated the National Youth Development Board, which later became Youth Move International, not till 2007. So the picture has changed a lot since 1995 on those. But what about the research? So that federal legislation that highlighted the need for research for students with disabilities actually resulted in a congressional mandate for the National Longitudinal Transition Study of Special Education students. The first one was conducted in 1987 to 1994, and it was a nationally representative sample of both schools and special education students, and they followed these students for 8 years. Um, the reports started being issued really in 1993. There were several that by then were already showing that students who were in the disability category of having a serious emotional disturbance had among the poorest uh, performances during secondary school and had among the poorest outcomes in the years after secondary school. So it was one of the first sort of red flags for us. Also, 1993, the Children's Mental Health Conference that was held by the Florida Mental Health Institute every year in Tampa had a symposium on studies that had followed children who had been served in systems either through special education or through mental health services and followed them into young adulthood. And that symposium, every single one of those four longitudinal studies were really reporting alarmingly poor young adult functioning. Um, and they suggested that young people weren't accessing services in young adulthood. So that was also sort of a red flag that was going on. And then in Australia, Patrick McGorry, who was really the father of the early intervention psychosis movement, had actually published his model system that he had initiated in Australia for treating early psychosis, for identifying and treating it. There was very little work in the US in that area at that point, and that research really started to be funded by NIMH primarily in 2007. That really looked at models to intervene early. So this was all a very early stage of research in 1995. So that sort of sets us back to what where was 1995, 30 years ago, and kind of what was the system like and what was the research like. We each thought that we wanted to describe or share with you how we got into this field of research. So I'm going to start with myself. So I was at that conference in 1993. I was a year out from my clinical internship, which I had done at Florida Mental Health Institute. And at that seminar, it really resonated for me. I myself had had a very difficult transition right after high school. I struggled with my mental health. I had a hard time assuming some of the adult role functioning that you need to have at that point. So it resonated with me personally. But I was also had a job as a data person at a nonprofit children's mental health agency in Boston. And after seeing that symposium, I went to the program directors of their adolescent program and then asked them what they thought about some of the things that were being reported there. And they absolutely agreed that they were really concerned for the adolescents in their programs as they aged out of eligibility for an adolescent program, that they really struggled to get them into any adult services and that they were really concerned about their outcomes. I had an opportunity to do some qualitative interviewing of some of those adolescents and now young adults and reported on those findings at the Children's Tampa Conference in 1995. I think because of that reporting, and partly because maybe some others hadn't been able to be in touch with, um, I got a call from the National Resource Center on Homelessness and Mental Illness later that year, who described that SAMHSA was wanting to fund a national experts meeting to understand what we know about youth with SED transitioning into adulthood and their risk of homelessness. And they asked me if I would write the briefing paper for it. And I asked if I could include Ann Vanderstoep, who was one of those presenters in that symposium in 1993, who had her own research that she was doing. So Ann and I did a scoping review of the research literature at the time to see what we knew about it, and the things that we could report on in that was that there was definite evidence that these mental health conditions clearly don't stop magically at age 18. They continue into young adulthood, and that the outcomes for young people who had had a serious mental health condition in adolescence were really typically very alarming in young adulthood. And that became the 1997 paper that Anne and I published that summarized all of that research more formally. So that's sort of how I got that essentially launched my career. I have done nothing since then but focus on youth in transition to adulthood with serious mental health conditions and tried to use the tools of research to make some improvements in the field. Nancy, how did you get into this work?
Back up a slide because you didn't get to see it for very long. And I just want to comment that this Davis and Vanderstoep 97 really is the unclaimed children of transition age youth. And if you've never looked at that article, you may have trouble finding it, but it's a very useful article and has remained robust throughout the years. Okay, next slide. Me. I'm Nancy Koroloff. I was with, before I retired, the Research and Training Center in Portland, Oregon, which was the sister center to the one here in Massachusetts. And also prior to the transition, this 84 to 2009, we were the sister center to the one in South Florida, which many of you may know from the conference. So I came out of the children's mental health side of things, as is maybe typical for many of us, um, and was a researcher with the Research and Training Center on Family Support and Children's Mental Health, which, by the way, its first name was the Research and Training Center on Handicapped Children in 1984. I know thank God our language has changed. We had one project in that first cycle that was about transition age youth, and Marianne has referred to that article. I continued to do mostly research on family advocacy, family support groups. And as the family advocates got older and their children got older, we heard more and more the stories about how difficult they were having, time they were having helping their children move on into adulthood and to find like productive lives that they could live, managing their mental health issues. Um, then in 2002, when the Partnership for Youth Transition came out, which was the first funded research out of SAMHSA, I became the evaluator for Clark County, Washington, and that's kind of where everything broke loose. From then on, I was all in for transition age youth. And it was on that evaluation that was the first time I hired a young person who, with a mental health challenge, who had been a client of the program we were evaluating as a research assistant. And from then on, we have always had young people as part of our research team. So 2002 on is really my trajectory here. And now, Amanda, what were you doing in 95 besides playing with your pretty polys?
Thanks, Nancy. Hi, everyone. I'm Amanda Basco. It's so fun to see some old friends in the chat and joining the webinar. I actually joined from a very different lens, as a person with lived experience who was really struggling with my own mental health. So I entered the world of mental health research with no research background in 2010. At that point, I was in my very early 20s and struggling with my own mental health. I had just failed out of the entire year of college, to the point where they rescinded my financial aid, so I was no longer able to go. And I went from being on the dean's list to having a very scary GPA, and gently asked from my university to take some time off for my mental health, which in hindsight was probably the right call, maybe not done the right way. But I was really having a hard time and I could not quite figure out what to do. And everywhere that I would go for mental health support and treatment, it was very adult focused. There wasn't a lot being talked about that felt relevant to my own life. And so I was telling some of my peers here today that I would go to therapeutic groups, trying to get some support, and the conversations would be about folks losing their mortgages or getting divorced. And I was still trying to figure out my life, my trajectory. I was in the early phases of figuring out what it meant to be in adulthood. And so it just didn't resonate. I didn't feel connected. And I was actually at McLean's at a support group for people who had diagnoses of mental health conditions. And they shared a flyer from the Transitions to Adulthood Center talking about wanting to find young adults who had gone through the system and wanted to help improve young adult services. And I came from being a major in special education. Mental health wasn't really a focus of mine. Research was definitely not a focus of mine. I actually felt like I was very intimidated by research. It was not something I'd ever dabbled in. But I was so excited about the idea of contributing to sharing and impacting services in a positive way. I've always been kind of an activist and advocate at heart. So what really drew me into the work was wanting to make a difference for other young people as I was struggling. And I really think employment at the center became a part of my own recovery journey. It was a huge part of helping me get to a path of recovery in my mental health and get back into work and academics. And so I just want to also make the plug that when people are talking about implementing research, doing that side by side with young adults impacts the research, but also the impact it had on my own life and my own recovery and working while I was navigating my mental health was life-changing. And I saw that in many of the young adult peers that were also hired. There were several of us that were hired into the center to think about the impact of national research and to bring our own lived experience into the work and really create studies and projects that were created for young adults by young adults. Um, and not in this tokenistic check the box way, but a way where we were really conducting interviews, creating questions we wanted answered, speaking to high level leaders about what research should and could look like. And that was kind of how I entered the work, along with many other young adults. So I was playing with Polly Pockets in 95 and probably starting my early snippets of my own mental health challenges. But fast forwarding to 2010, I really got to experience what it looked like on the lived experience side to impact research on a national level. So we'll talk a little bit about studies and how we had an impact later on, but that's kind of the who I was and where I was. Also, quick shout out for those in the chat who are loving on the Polly Pockets like I was. There is a Polly Pocket Airbnb in Massachusetts, so feel free to check it out and relive your young adult glory, as I will. I'll turn it back over to you, ladies.
Okay, well, so Amanda, from your perspective, then, what are 2 to 3 important studies or projects that, from your perspective of these 3 decades, even though you weren't there in the very first one, but what are 2, 3 important studies or projects, and why, from your perspective?
Yes, thank you, Marianne. So I think the big point for me is being involved in research. The biggest and broadest impact that I saw were studies where young adults were really front and center in the work, in designing, in developing the research, and thinking about why research mattered, and crafting research that could directly result in impacts and messaging to young people themselves. So the slide up here is really the process that we created at the Transition Center of implementing young adult voice in research, where we had several levels. And many folks across the field of engaging disability voice and mental health voice and participatory research use these levels differently, but I think at our center we talked about the highest level of young adult involvement were youth-led projects. And so for me, those projects really had a direct impact on the field of work, but also the people doing the work. And so I got to see researchers who typically had no involvement with young adults themselves working side by side and changing that kind of researcher young adult dynamic where we were peers crafting the data, the questions, and the delivery together. Can we go to the next slide? So one of the studies that I wanted to talk about was the peer academic supports for success, or the PASS study. And this was a study that I got to partner with Marianne and several of our colleagues on, where we really looked at creating a peer academic program where young adults were peer partners to students in college universities. And this was with the Boston University and Wright State University. And it was a model where peer support was happening on college campus to impact the academic success of students. So this wasn't just about what it meant to recover from mental health, but it really drove home the impact that mental health had on college and academics. And as someone myself who failed out of school, who struggled to manage my mental health, who went from being a stellar student in high school and in the beginning of college to not being able to physically even show up for class, let alone focus, pay attention, engage in academics, creating a space where young people who had gone through those experiences in college could provide peer support in a really structured way to help students was a huge asset for me. And so my role and other young adults' role in the study was we created the model in partnership with Marianne and amazing Dory Hutchinson from Boston University, and our partner Laureate Wright State, and created the curricula, drafted a lot of the activities. We conducted all the interviews with the peers. We conducted the hiring support in hiring interviews as well as research interviews with all the peers. We met and went and met with them on campus to train them on how to implement the model. And we're really involved in all of the pieces. I remember some of those meetings where myself and Laura Golden, one of my colleagues who is also a young adult lived experience, really shifted the entire manual and presented a complete rewrite of some of the sections to Marianne and Dory because we felt like we needed to think a little differently about how we talk to young adults, the language used, and some of the examples with accommodations, and kind of bringing that home from some of the interviews we did. And they were like, oh, yeah, this makes more sense, run with it. And so just the freedom and autonomy that we had as young people who had really walked this walk and experienced this was huge. And then to see it actually in real time on these college campuses having an impact and these students resonating with what we created really showed kind of how we thought about research resonating with other young adults. So I think the youth culture impact that we had on research made those one of the more important studies for my own experience and someone who got to see the impact that mental health can have on your academics, on your executive functioning in school, and then go to someone who's creating this model to help other students and really seeing them thrive with the right level of support in that peer space to feel comfortable, to be open, to talk about mental health on a campus where maybe it didn't always feel um, like a space to have safe conversations. Mental health is so stigmatized in so many spaces, and we've gotten so far, but we still have so far to go. That to be able to build those safe spaces and have an impact on other students and keeping their resilience levels high enough to maintain in their academic career while they were figuring out their own recovery journey, I think had the biggest impact on my own experience. So with that, I will turn it over um, and ask, I can't tell who's next from the slide. Is
It's Nancy that's next.
Nancy. So Nancy, let me ask you, my friend, what are the most impactful research studies you experienced in your career?
And I really came at this in maybe a different way in that I got thinking about what were the things that really influenced my research and made me into a different researcher over those many years. And the first one that I remembered is this Ellen Conrad's article in 1996 or study in 1996, which I read in 1996 because I was deep into anything evaluation. And she did one of the first articles, at least, that did a good job of conceptualizing multiple levels of outcome. I come out of social work where often we're looking at the outcomes at the individual level. So it's, what's the impact you've had on this particular individual? And what are those outcomes and are they positive? I was always interested in looking at the other levels of outcomes. So what changes had to be made in the agency to serve that group of clients? What changes needed to be made at the community, at the service system level, my favorite, the service system level, state legislation, those are all different levels that one could be looking at outcomes for, and not exclusively at the individual level. So when she published this article, it was like this light bulb went on. Uh, and frankly, Ellen Conrad moved to Portland and worked in the Portland public school systems for many years after she published this. She was my idol. Next slide, please. Um, After when I started working with Mary Ann, and this article, although it came out in 96, the Johnson, Morrison, and Callaway, it came out in 96. I didn't read it until later when I started working with Mary Ann and we started trying to figure out how do you measure the change in social in service systems. If you are changing the way young people are receiving their services, the youth and young adults who are in transition, how do you measure how that changes the service system, not just whether or not those young people are more successful? And the Johnson, Morrissey, and Callaway of 96 was one of the first, maybe the first, that really tried to measure change at the service delivery system. And it used this marvelous tool called social network analysis. And I was entranced, and it was like someone had given me the key to the kingdom, because there was finally a tool, although one that took a lot of work and was kind of expensive, but it was still a tool that could measure when a service system changed and how it changed. And that was the tool that Mary Ann and I then used. This article, which also includes Matt Johnson, who was in the first one, was one of our first on measuring how the interorganizational connections changed when you changed the way transition age youth were served. Next slide. And then this is my third one. It's a whole issue. I kind of came full circle because my roots are in program evaluation. But in 1919, the Research and Training Center, which was then called Pathways to Positive Futures, it was the Portland State Research and Training Center on Transition Age Youth, did this special issue of Focal Point, our newsletter. And in it, we highlighted the local evaluations that were being done by those grantees, the Healthy Transition Initiative grantees. And we had come through a difficult time. The national evaluation had been defunded, done away with. There was no national evaluation except for the what was called the NOMS, the National Outcome Measures. You can go to the next one so people can look at it. These are the HTI sites that were highlighted in that. And I was really proud of that special issue, because what we were doing is saying, even though the money isn't there for the big national evaluation that we really need, these local evaluators, some of them very experienced, very well trained, are still producing knowledge about the local sites that is useful, at least to the local sites, maybe useful beyond that. And maybe that's where we have to come back to when things get tough. So that's my third kind of special issue, a whole bunch of things all in one, but it really comes back to how important some of the administrative data is, some of it that we make the most of it that we can, and that the local evaluations and what is being done there can also really inform us. And now it's back to Mary Ann. What are your three most? If you could get it
Thanks,
to
Nancy.
three.
I did want to just also, I saw a question from folks about the papers that are in this webinar, and we are going to be adding when we have this on our website, a reading list, so that everybody will have access to the list of studies that we've been talking about. So I really struggled with this question, because 30 years of research, what are the 2 to 3 major projects? I've organized my response into funders, in part because it's hard to do a lot of research without having some funding.
Yeah.
And each of the funders have had their stamp on kind of the kinds of questions that you could ask. And Diane Sondheimer was a champion at SAMHSA for getting some funding towards grant programs for sites to actually implement new and innovative ways to serve transition age youth and young adults. She also was very helpful in helping there be contracts where we could develop the knowledge more. And this first slide is about 2 surveys that SAMHSA funded that were of states' child mental health services and then their adult mental health services, where we really got to ask in detail about what they were doing for programs and policies around the transitioning population, how they were serving them, how they were handshaking with one another if it was happening. And that allowed me to publish sort of a summary in 2003 that was also based on a briefing paper for a SAMHSA meeting that kind of described sort of in light of the needs of the population, kind of what should the service system look like, and kind of what did it look like, and also partly because we had a picture. We knew all the red flags from the 97 review paper that young people needed support as they transitioned into adulthood, but we didn't know that much formally about the system. And so these second two papers were really describing state mental health authorities reporting on what they had. And at the time, so this was from 2000 and 2003, a quarter of states' children's systems, so a quarter of the states in their children's systems and half of their states in the adult systems offered no programming anywhere in their state for focused on transition age youth. Um, what we also found is that most states that said, hey, we've got a program for transition age youth, they had one somewhere in the state. There were a few states that were doing something more comprehensive, but it was a real picture of what was going on in the country around services for the population, or for the group of young people. And I think and hope that it helped Diane to continue to advocate for grant funds to be able to improve those services over time. So that was my first pick. The second pick comes from funding from the National Institute of Mental Health and the National Institute on Drug Abuse, shorthand for, or shorthandedly, NIMH and NIDA. We had recognized the need for evidence-based practice for specifically for this age group, that at the time there was really nothing that had specific evidence in this age group for its efficacy. And one of the rapid ways to try to be able to develop that is to take an evidence-based practice for another population and adapt it for the population you want to serve. So one of the most pernicious outcomes that we had found in our previous research was that an awful lot of young people with serious mental health conditions in public systems had been involved and snagged into the justice system. And so I worked with Scott Hengler initially, and later with my wonderful colleague, Ashley Shado, to obtain funding initially from NIMH and later including funding from NIDA to adapt multisystemic therapy for use with emerging adults with serious mental health conditions. Multisystemic therapy is one of the strongest evidence-based practices for reducing recidivism in juveniles. So those who have already gotten in trouble with the law, to reduce their involvement in offending behavior afterwards. And we wanted to be able to do that for this population. And so in doing the adaptation, there were several major things that we had to solve that I think is just a general contribution to the field. MST is a home-based model that primarily works with parents to help them change the behavior and support the positive behavior in their child, in their adolescent. For our emerging adults, 17 to 24-year-olds, that was not going to be the right approach. We had to figure out how to engage the young person on their own behalf in very difficult circumstances to be motivated to do the work that it takes to address their mental health, but also to change some of the behaviors that were leading them into offending behavior. And so Ashley and her colleague, Mike McCart, really worked hard to figure out how do we do that to engage the young person. And then how do you assess involving families? Because it's not like they're not involved in young people's lives, although sometimes they weren't. When you're getting up to 23, 24-year-olds, some of them were really not involved with their families at all. So how do you assess and then figure out how to engage families in helping their young people make these changes that are very difficult? So that was another innovation that Ashley with Mike McCart really led. And then finally, how do you build interventions to treat mental health conditions into multisystemic therapy, which was not really developed to do that. So there was a lot of innovation in this. I will also say we had to develop innovations to try to follow this population over time. This particular group of young people tended to move around a lot. They weren't your enthusiastic participants in research. So we had to come up with those innovations. And so these are some of the papers that reflect that work. And actually the final results of the large clinical trial, we're still analyzing. We hope to have it out really, really soon. And then the final, yes.
Sorry, Marianne. I
Yeah.
just wanted to mention that there was one question that came in.
Great.
Um, from Leslie Ann Byam. And this, you may want to get through what you're saying first, but I wanted to get this out there. She was asking, what is the organizational culture needed to include transition age youth as peers, and how did you create that culture? So, I think that's going back to a little bit when Amanda was speaking about how she was included and young adults were.
Included as well. Yeah, absolutely. It's a great question. I'm going to start. I'm hoping, Amanda, you'll jump in also. Um, I think one of the one of the things that created a culture in which that could occur was essentially that there was a request from the granting agency to do so for the research, which helps with motivation. Not that we didn't want to do it, but that it's explicitly stated was really important. I think also that all of the sort of faculty, like researchers, were really enthusiastic about doing so. And all that enthusiasm is important. So we started from an enthusiastic place. I think the devil is in the details. Learning to do it well, we realized after several years, it's just always going to be an ongoing process that we really um, one must have humility about what your expertise is as a faculty or senior level researcher, that your expertise largely comes from your uh, kind of academic training and formal research training, but that young people's expertise that is equally as valuable comes from their lived and living experience. And figuring out how to do that without kind of falling back on our habits of problem solving when something comes up and forgetting to involve the young people in the project in that was one of the things that we had to address over and over again. So we learned a lot, and that has gotten formalized into several things that we've got on our website about how to do that better than our trial and error to do so. But I think the desire, the humility, and really recognizing the expertise that young people bring to bear is key. And then, Amanda, what would you add to that?
Yeah, thanks, Marianne. I think those are all very important points, and really started the process. And it was a learning, growing, and evolving system. To Marianne's point, things changed constantly, and I think the willingness to think outside the box and to continuously learn and grow is really can be uncomfortable, but was embraced by the team at UMass, which really made it possible. I think the two main things that I would add is time. You have to be willing to slow down and give it more time. And it's hard to do that in a research-driven, fast-paced, grant-funded environment. But I think the team at Transition Center allowed for the time it really took to train up young adults, to add a layer into every stage of the work for young adult value and input. And things did move slower because there were more layers to be done. Um, and it was painful sometimes because we had to take that extra moment. But the return on investment, I think everyone would say would be tenfold. And I think the other piece to Marianne's point is having faculty champions. We had faculty that really supported this work and were willing to shift the hierarchy in research, slow down, take input, do things differently than they've ever done it, and get constructive criticism when young adults felt like their voice wasn't heard and change how they made the approach. But I also think someone who could also provide some level of professional mentoring. I think Catherine, who's now running the world, was really the operations director then, but she was I would say, a professional mentor of the young adults, very hands-on, constantly with us, helping us think about professionalism, helping us learn research. We'd never done this work, so helping us really craft interview scripts, learn how to send professional emails, learn how to recruit participants for a study. She was really on the ground with us as kind of I would say that like she was a Jill of all trades, but in this role, we kind of turned her into our professional mentor. And then having Marianne as kind of the research mentor and Marcia Ellison as the person who was helping us learn about how to translate knowledge and disseminate the work and being willing to let us bring in the most creative ideas like YouTube and social media and innovative ways to get young adults engaged, um, and do things differently and kind of shift the norm was I think that's how you create the culture is you break the culture in half and you rebuild it and mold it from the ground. And it was allowing an entirely different new uncomfortable culture to evolve. And that takes a lot of uh, willingness, flexibility, creative problem solving, but a lot of time for sure.
Can I make a quick comment on that? Um, there's quite a difference between between young people leading the research and young people being part of the research team, and you have to kind of understand that difference. And the other thing that I found recently is there's some fascinating research out there about um, how meetings are run and the microaggressions that we all put on to young people and other consumers in meetings in terms of not meaning to, but dismissing comments or not allowing them to talk. That level of research, I think it could be very useful to anybody who's thinking about bringing young people into their research team because we do it completely without our own knowledge. So that's it.
A great addition. Thanks, Nancy. So I think we'll move on and we'll take the rest of the questions after the discussion. And just to say, Catherine Sabella is our discussant, who is the person that Amanda was referring to. So lots of good stuff yet to come. So I'm going to jump to the last so-called project, which was funding from the National Institute on Disability, Independent Living, and Rehabilitation Research, which we refer to as NIDLR because that's way too much to say. In 2009, we became aware that they were going to make available funding for two rehabilitation research and training centers, or RTCs, that were focused on transition age youth with serious mental health conditions. For myself, my own research really hadn't been in schooling and working within this population. It had been more on mental health treatment systems and those kinds of things in the justice system. But realizing that if we could crack the nut, so to speak, of the knowledge to improve their outcomes, to allow them to have to get out of school and training and launching a work life what they want, that would be a tremendous contribution to the field, that this would be something that we should apply for. And we were very fortunate to have had Marcia Ellison join our faculty shortly before this. And Marcia came to us from Boston University, where they had an RRTC on adults with mental illness. So Marcia was familiar with the granting agency and what an RRTC looks like. And we put in 15-hour days, 7 days a week for about 8 weeks to put together the grant in 2009. And we were fortunate to be awarded that RRTC, and Nancy's group was awarded the other one. And we've had that funding since 2009, which has allowed us to do a tremendous amount of research that has really focused on sort of what contributes to education and employment success and challenges in this age group. What is the context of that around the systems and services? And we've been able to develop and test at various stages of that, a variety of interventions listed here by their ever popular acronyms: PASS, BRIGHT, FAST, HYPE, and TEST. And Amanda talked a bit about PASS. So in all of this research is on our website, so I would refer you to that. We were just also talking about how NIDLR requires researchers to partner with people with lived experience in their research, and that was a tremendous boon to us. I do want to say one of the joys of doing research is sometimes that there are discoveries that your research wasn't addressed to find, but you find anyway. And in some of the research that Catherine Sabella did, just asking questions about what was the pathway for people when they left high school and into a young adulthood around schooling and working, that one of the things that she discovered in just asking about that was the tremendous impact that getting a diagnosis and then getting prescriptions and then getting a different diagnosis from somebody else and different prescriptions. And that process of trying to understand one's mental health condition from different providers had such a strong impact on young people and the way that they viewed themselves and their health and their mental health that had an impact on their lives and their schooling and working, I think was a really important sort of thing that we discovered, even though it wasn't the focus. The other thing I'll bring up is that Catherine and her colleague Ian Lane in a longitudinal study where they were casually asking about your gender identity as part of just the demographic section, realized that young adults with serious mental health conditions were reporting different genders over time. And they developed better methods for asking the question about what is your gender as a result of that research. And that clearly wasn't necessarily focused on learning and marking, but it was an important side effect, or not side effect, a discovery within that research, which is really exciting. Um, and the last thing I want to say about the funding from NIDLR is that NIDLR is one of the few agencies that fund research that really emphasize getting the findings of your research into the hands of people who will use that knowledge, into those who have the lived experience, those who support them, those who provide services, not just to other researchers. And Marcia Ellison has really been a national leader in figuring out how to do that with young people and how to get it out to the folks who really can use the knowledge. And our next section is about that, so I won't say much more, but I think that was a really important development within the field. And I'm going to make one more point. Sorry, 30 years is hard to summarize very quickly, but it's always really I found it incredibly important to keep up with the findings about, in general, the changes in the movement of young people into adulthood in our society, because it has changed tremendously since I was a young adult, and even within this 30-year period where the internet, social media has come in. We went through the Great Recession, we went through the pandemic. All of those have had specific impacts on the lives of young people, and that has to be part of what we do consider in our research. And so I just wanted to highlight these three major looks at the changing nature of young adulthood. The MacArthur Network on the transition to adulthood, who published these two books that are still relevant. They published them in 2005. And the National Academies did this consensus study on investing in the health and well-being of young adults, and that was published in 2015. That's a free PDF if anybody wants it. And it has a tremendous summary of what was known by 2015, and it's still relevant today. So just kind of keeping an eye on the broader field that has an impact on the specific population of young people with serious mental health conditions. So with that, we wanted to move into sort of what is important about knowledge translation within this decade. And Nancy's going to talk a little bit from a researcher's perspective, and then Amanda's going to take it from there.
Well, just briefly, as you can see from this slide, and as you all know, in 30 years, the way we disseminate research findings has changed tremendously. Not only have we stopped trying to reach out to academic audiences only, but we're now doing things with the internet, and there's an increase in the diversity of methods that we're using. It's not just academic journals. And I think just recognizing that in 30 years, those kinds of changes have happened. And then I'm going to let Amanda really focus more in on some of the methods that she's helped develop. So go for it, Amanda.
Sure. So I think what's really interesting is when it comes to traditional dissemination of research. We all know a lot of this work lives inside research journals, and the people that are reading research journals are typically academics, researchers, people who are trying to create a new model or program. They are not young adults often. They are not families. These journals are not written to the people who are directly impacted in their day-to-day lives by mental health. So what was really fun at the center and and across the research is the ways in which we thought about how do we get the word of what is happening and what's being learned out to people in the general community who aren't opening these research journals, who aren't looking at research, but are really looking at what do I need to know? What does my family need to know? What do the people in my community need to know that's coming out of these studies? And so, working with Marcia Ellison and her team and the Portland Center, dissemination got really creative. And some of the cool projects that I wanted to highlight that have happened over the last several years that the center has kind of evolved and built started with things such as simple tip sheets, which are the images on the left side of the screen. And for those of you who aren't able to visually see the screen, they're really simple one, two, three pagers that are visual with text that disseminates the lessons learned from research and practice into what do you need to know in your day-to-day life. So, topics such as applying for a job and all the things you need to think about and prepare for when you're trying to get work as a young person. Do I disclose my mental health condition at work? What are the things I need to think about? What are the interview questions I should be asked? What's legal and not legal to ask about my mental health? And accommodations, topics that were really found to be important and relevant, and we were conducting research about or creating services to address, but we wanted to get the real life findings into the lives of families and people thinking about these things and trying to build their own lives and livelihood. Another really creative one, which I was not as involved in, but loved to see happen, was graphic novels, and visual shorts. So on the right side of the page, for those who aren't able to view it, there are graphic novels about similar topics, what to think about when you're applying for benefits, how can accommodations impact you, how do you advocate for yourself or your family in an IEP meeting. And this really brought to life in a more young adult, culturally centric way topics that were impacting young people. And so how do you do that in a different modality that I'm going to look at a tip sheet. I am not going to read a 30-page research article. My family, who's dealt with mental health in many ways through my own lived experience, is not going to digest a 14-year research study, but they're going to want to know what came out of it and how. And this is the way we kind of got that into the hands of people who really needed that data, but didn't know how to understand it. Next slide. Some other examples is a lot of the young adults at the center, when we were going for another iteration of the grant, Marianne and Marcia and folks sat us down um, and specifically said, what are the ways we should be getting info out there? You create the projects and come to us. So these were young adult thought about ideas that were proposed by the young adults at the center and National Young Adult Advisory Board, which we brought on. And some of those ideas was a YouTube series called Come Back TV, which was for young adults by young adults. And the stars in the show were young people talking about all these issues and interviewing researchers to get down to a general level of understanding of some of the studies that were happening, which then evolved into the Stay Tuned podcast, which is still actively running today. And you should go check them out on Spotify. Plug and shout out for them because they're awesome. They actually interviewed me and what it was like to be a young person working in research, similar topic to today. But they talk about the lives of young people right now in 2025 and what it looks like. They're interviewing researchers, they're talking to people who work in the field of mental health services in a way that makes you want to listen, is digestible, and is a different approach for people who are podcast listeners. Like, this is a different way for them to digest that information. Next slide. And then we were trying to think about how do we maximize social media and different trends and themes that are happening in the world of social media, because that is a big place where young people are going to find connection and comfort and information. And what came out of that was the Mental Health Memes Project, where young people on the staff and at the National Center were creating memes that were relevant to mental health that kind of took on some of the big viral images, like the image, one of the images on the screen is the viral image of our friend in his mittens. Some of them are from movies, like the Marvel comics. Some of them are of Obama. So, like, what are the political trends? What are the funny moments that are visualized in the social media networks, and how do we tap that to send something out that's funny but salient about mental health and recovery and the work we're doing. And so one of them says on the page, when you face a lot of trauma, you're still worthy. And it's a picture of Thor with the hammer. And so it's poking like jokes at current trends in movies and cinema, but also talking about like the resiliency that young people live through, and making a positive statement, but kind of tying it back. And this work also may have felt a little more disconnected from the day-to-day like research data, but it also brought commentary to mental health in a way that young people were interested in and engaging in, and then brought them into the work of, well, what are the people doing that are creating this? And what do the young adults have to say about mental health today? So there's tons more memes out there as well on the website. And I know Dee's been sharing a bunch of links in the chat, and we'll be sharing some of those with the slides that talk about some of the ways in which we've shared information. And I think the most important point is that what's happened over 30 years is so many different things, and the evolution of young adults will never stop. Youth culture doesn't ever stay stagnant. It has changed from 10, 20 years ago. It has changed from when I started at the center, where we were focused on YouTube, to now where TikToks are being created and memes were a huge thing, and now people are evolving into short videos. And how does this all look has always shifted. And when we shift with that and bring in young adults to stay up on trend and talk about their own culture and what makes sense to them today is when you keep the work we're doing relevant. And I think that's really fun. So I'm going to turn it back to the crew.
Thanks, Amanda. That was wonderful. Um, so we wanted to end on sort of what do we think gives hope to the field? So a little bit with an eye towards the current political climate, where I think many folks are very concerned about research funding and research work, federal government agencies that have been doing research. And so we each wanted to kind of offer some things that we think are hopeful for the field of research in youth and young adults with serious mental health conditions as they transition into adulthood. Um, so for myself, I feel like all the things that sort of, in many ways, brought me into this research um, still exist as a pressure to continue to do research in this area. That we've got young people who I know are not completely satisfied with how they're able to be supported in school and in the stages after secondary school and in their work lives and in their lives in the community. And they want better services, and getting better services includes needing research on what works and what works for and with young people. So for me, the major hope is that the pressure, the demands for research will remain regardless, that young people, people who provide services, nobody wants to provide something that's not effective, that all of that demands research. And that I think that we as researchers, as long as we look for every opportunity we can to try to apply the tools of research, even maybe in the face of very little funding, that we will continue to grow the knowledge base and how to do that well. Um, Nancy, what do you feel gives hope? Or is it Amanda who's next? I can't remember.
I'll do it next.
Okay.
I'll let Amanda do the wrap up. So the hope, I think, first of all, just realizing how far we've come in 30 years and that we've done that through the ups and downs of the political system. I remember when Reagan was elected, I thought my life was over, and it wasn't. And I think just keeping that hope in front of us. The other big hope to me is the young people with mental health experiences, who've been through the service system, who are successful in college, who are going on to do this research. That's really our hope, is these new researchers who are coming up that don't have the supports that many of us had, but that are still committed to doing research in this area. And if we need to be supporting, fostering, nurturing that group of people in order to keep this alive. And now, Amanda.
Yeah, I think I agree with you both. I think it's finding the champions gives me hope that there's still so many champions and people who are passionate about this topic, and that times can be challenging. We're all seeing funding cuts and uncertainty. But what we don't lose is the energy and the dreams of a lot of people who still feel like this work is valuable, and that we are in a space where individual voices matter, and we're seeing that happen in grassroots efforts. And so continuing to ally yourself and keeping hope up through raising your own voice, I think we have more power than we sometimes give ourselves credit for. And so the hope for me is that people keep sounding the alarm that this research is important, that the lives of young people are important, that there's been such unique impacts in recent years through the pandemic and so many other cultural impacts on young adulthood and what that even means. And this is our future. These are the people who are kind of entering into this world. And it's important for us to keep fostering that voice and yelling loudly together as much as we can. And I think what gives me hope, and I think should give you all hope, is that we're all here today, that we have so many people on this call that are still excited to learn and grow together, that we're not staying silent, that people are still hungry for information, and that it's out there. I was talking with Marianne and Nancy about how sometimes in this world of research, the flame may simmer, but it never fully goes out. You just need a group of like-minded people who are willing to light that again and kind of see it through. And so I think finding those people, and maybe you should be connecting with each other after this webinar if you're in the chat and invested in this topic, because that's sometimes how you find your people. So that to me is hope. Today is hope. So I think we just need to keep fueling that fire together.
Thanks, Amanda. And on those hopeful notes, we are going to turn this over to Catherine Sabella, who's serving as our discussant. And we hope that you have had moments to reflect yourselves and have learned something about the launch and the history of this field.
Thank you, Marianne. Hi, everybody. I'm Catherine Sabella. I am Director of the Transitions to Adulthood Center for Research here at UMass Chan Medical School, and I was honored to take on that role as Marianne transitioned into retirement. I am also co-director of the CIRC Center with Elizabeth Thomas from Temple. CIRC stands for Community Inclusion and Reflective Collaboration Center. It is one of the RRTCs funded by NIDLR on young adults with psychiatric disabilities. And here at UMass Chan, we also have the Learning and Working RRTC, co-led by Marcia Ellison and Michelle Mullen, who I think are both here. And I have a role on that project as well in terms of being a liaison for the young adult and family advisory boards. So first, just thank you to Nancy, Marianne, and Amanda today for bringing us this hope and bringing us this opportunity for reflection. And thanks as well to Gwen and Bree for their presentation last month, which was also a great honor to be a part of. You know, a lot of reflections coming up for me, and I'm gonna just talk a little bit on in response to some of the points that were brought up. But I also encourage folks who are still on the call to put any questions you have in the chat, please, because we could have a few minutes for that as well. I think I feel called to share. In 1995, I was on the precipice of my own transition to adulthood as a 15-year-old and navigating the world in the 90s. What brought me to this work, I fell in love with research in my undergraduate program, just the idea of being able to use data to understand social phenomenon. And you know, being a young adult is hard enough. And I say that, you know, I've said that over the years, and you add a mental health condition. And for me, I wasn't diagnosed with a mental health condition until later in life. But gosh, you know, whenever I present about this, I just remind the audience, providers, policymakers, whoever you are, to reflect on your own young adulthood, that rite of passage, and the challenging times that come with it, regardless of who's president or what's happening. And I was so excited to begin working with Marianne in 2010, early 2010, when the first Learning and Working Award was funded. And you know, I've been along for half this ride, I guess, is what I want to say. And the first half, it's always a joy to hear about the early days and how far we've come. And Marianne is right. You know, there is a new era of researchers taking the helm, and we're so excited that her and Nancy and Gwen and others were willing to come together and reflect on the last 30 years, not in a here's our work is done, but in this is what we've accomplished, and remembering our roots while also simultaneously reflecting on the work that still needs to be done. And I'm just so proud to be a part of the Transitions to Adulthood Center for Research, where a lot of this work is being done, but there's plenty of work to be done here. And, growing a network of collaborators across the country who are doing this work is also very, very exciting. So I think Amanda said something about how youth culture is always going to be youth culture and it's always changing. And I think that's my first reflection from today. As a sociologist, I get really excited thinking about the subculture of young adulthood and everything that that brings, and looking at what 1995 looked at compared to 2025. We have to constantly be evolving in our research efforts around young adulthood, because young adult culture is always evolving as well. And so even in the last 15 years doing this work, seeing the increasing presence of social media, smartphones, the instant gratification, the digital world that young adults are navigating, thinking of how the growing influence of artificial intelligence and what that is, how that is showing up in young people's lives. We're looking at the gig economy. And, those are terms that didn't exist 15 years ago, but are very prevalent and relevant to young adults' lives today. And if we don't, kind of go with the flow to a certain degree, we're going to miss the boat. And so working here at the Transition Center to, Marsha and Michelle are working on some great research projects, looking at the gig economy and what that means to young adults who are making, they're basing their livelihoods on some of that, looking at the role of career and technical education, and some of the, I'll say, backlash towards the very overpriced college education in this country and how that impacts young adults. Liz and I are looking at, in the Circ Center, what does community participation mean? And how has that changed? And how can we, needing to understand young adults' perspectives on community participation in order to better serve their needs. I remember starting this work in, 2010, 2011, 2012, we would get emails from, I remember one particular email we got from a family member, a parent, saying, help, my son is just rotting away in the basement playing video games. He, has depression. He's not getting out. I don't know what to do. And I'm not saying that that's what we want all young adults to be, but now 15 years later, we've got a podcast episode with one of our young adult advisory board members talking about how gaming saved his life, and the social connections that he made in virtual gaming were the people that showed up for him when he needed them the most. So this is just constantly evolving. And relatedly, one size fits none has never been more true in this country. And needing to continue to focus and expand on the diverse experiences of young adulthood when we are designing research and interventions and policy and services. We need to constantly be considering the multitude of experiences of young adulthood. While there is a young adult subculture, it's going to look different. It's going to look different depending on if you're in an urban setting or a rural setting. Are you in a blue state or a red state? Are you, what's the color of your skin? What's your gender and sexual identity? All of these things are going to contribute to the experience of young adulthood. And we need to find ways to incorporate those experiences in our research. Yes, for certain populations, we want to be helping them succeed in high school, like the Bright Project where I'm working right now, but at the same time in communities that are, having, ICE raiding their communities and, fear about family member safety, you can't be tone deaf to those experiences when you're trying to support kids and family members through high school while dealing with a mental health condition. And importantly, one of the best ways to incorporate those experiences is through partnership with young adults. As Amanda talked about, this is something I've been working on since day one at the center. I remember Marianne saying to me, okay, Catherine, we need you to we gotta figure out how to do participatory action research. So I think we need to hire some young adults with lived experience of mental health condition. Let me know how it goes. And I just remember sitting around looking like, I don't know, how do you do that? How do you create the infrastructure for that? What does that look like? And we made plenty of mistakes along the way, and I'll be honest, we'll make more. But what we've grown in the past 15 years and having the rich and just rewarding experience of partnering with young adults with mental health conditions in our work is, definitely one of the proudest aspects of my career. Amanda's among them. I had the pleasure of recently attending a wedding where I got to sit at a table with several people who at one point were young adult research assistants, and now I consider my colleagues in many different ways, Amanda included. But also our challenge here is moving from just, I'll say, a consulting role of young adults with lived experience and moving young adults into more meaningful partnership and shared decision-making on the research and dissemination studies. And Liz and I are doing that in the CERC Center, and we will hopefully be applying for a grant to further understand how to engage and what I say level up young adult partnership in the research that we are doing. And then just a couple final points is, again, along with the changing youth culture, we also need to be keeping an eye on the moving technology and digital experiences of young adults and engaging young adults in research and in mental health services in ways that feel good to them and feel natural to them. And again, this is where your young adults are going to lead the way because they are living it. And as we get older, we can continue to find young adults to partner with us to really share with us on what it looks like and feels like to them. And, I think I think one thing I see too is, as Marianne and Nancy explained so well, the foundation of the young adult mental health field. I think what we're also seeing is a blending of young adult mental health into other areas of life. And there are still many silos that need to be broken down with work here at our center with Laura Kelly and Ashley Shado and others, finding ways to incorporate mental health and substance use research in more meaningful ways among young adults, bringing in physical health, OBGYN, family planning, all of those things. Young adults increasingly, have accepted mental health and mental illness and mental health challenges as a way of life. There's still stigma and there's still discrimination, but it's changed. And the way they're talking about mental health, they're using less of this othering kind of language and othering experience and really incorporating it into their identity and are breaking down barriers. And I think oftentimes mental health services, we'll talk about the mental health literacy of young adults, but I think it's really important that mental health services listen to young adults and become literate to the way that young adults are speaking about mental health. And I think that's important to consider as well. I'm going to take a minute to just look in the chat before I keep babbling on and on, just to see if there are any questions, and encourage you all to put any questions you have in the chat. Somebody from Connecticut asked, how do we identify community partners that have participated in the training and are implementing it? I'm not sure exactly which training you're referring to, Anita. If you wanted, if you're able to raise your hand, I don't know if that's possible. I'd be happy to unmute you in that. Somebody brought up, of course, and again, the elephant in the room is the social political climate that we're in. And I did love how Marianne organized kind of some of her pivotal work by funder, because, it is important in this time. I've never experienced a time like this in my professional career where scientific research really is being attacked. There's a lot of people and entities that are being attacked. But maintaining the funding to do this work is very important. And I think we're also seeing service organizations feel the same kind of pinch. And so finding partners in our research, finding funding for our research will continue to be a challenge, but one I'm hopeful that we can continue to navigate, because there's still so much work to be done, as I already said. I don't see any other questions in the chat, so I'm just gonna, oh, there's somebody with a hand up. Leslie Ann, I think I'm gonna unmute you. Are you there?
Can you hear me?
I can hear you. Hi, Leslie.
Excellent. So I I had to switch computers and lost all the chat and all the resources that you guys dropped in the chat. Will that be sent out with anything at all? Will we
Yes,
be able to
yes.
access that? Okay, perfect.
Yeah, thank you for asking. We will be posting this recorded webinar on our website, along with what Marianne referred to as a reading list. So many of you commented on the great resources and seminal papers that were mentioned. And so there will be a reading list as well posted on the website. I'm not 100% sure, but if possible, we will alert you all who registered when that is posted. But I would say to keep an eye on our website for that information. Just in closing, I just want to say thank you again to the speakers, but thank you to all of you in the chat. I know there are some familiar names or out there listening today. There are some familiar names and also new names and faces. And, you know, I struggle sometimes when I, as a researcher, am asked to come speak about something, especially when it comes to speaking to family members, young adults themselves, community partners, service providers, etc. Because I have a few initials after my name, but I'm not the one in the trenches, and I'm not necessarily an expert on anything. And I think we need to continue having conversations and looping in and making connections between service systems, researchers, young adults, family members, policymakers, all of it, because we all have a claim in this world, and I don't think any of us could. Well, I know none of us could do it alone. So, thank you all for being here. I'm just checking. I don't see any other questions in the chat. So, Marianne, thank you for everything you've done for me personally, professionally, and for the field. I really hope this feels a bit like a celebration for you in all the work that you've done, and just an honor to be here with you all today. With that, I think we will close it out. So thank you, thank you.
Yes, thank you. There's a whole bunch of thank yous in the chat. Thank you, Nancy, Marianne, Amanda, and Catherine for this amazing look at what you've done and thoughts about the future. As Catherine said, the recording and slides and reading list will be made available on our website. And after this webinar, there will be a survey that pops up to let us know how we did. It would be great if you could fill that out. It's always helpful for us to know what worked, what didn't work. And please be on the lookout for future webinars and events from the Transitions to Adulthood Center for Research. Thank you everyone for joining today.
So are we still on for a minute?